Good morning to all of you, and thank you for the organizers for inviting me on this academic CM. So today's topic, I'll be speaking on understanding the evidence-based selection of blood donors, weaknesses and opportunities. So whenever we think of the blood donor selection, the first thing which comes to our mind is the blood donor selection criteria. So its importance is, it is made to safeguard the health of both the donor recipient and the donor, has a high quality evidence for the selection of prospective blood donors. They are evaluated and updated for many medical conditions, especially in relations to high risk behaviors also. They have the clarity and the potential to optimize the blood donor deferral and also enhance the blood safety. So these are the importance, because under any conditions, there should be some balance should remain between the blood donor deferral and also safety of the blood. So it's always a challenge to select the right donors. So for right donor selection, we need a good criteria, as well as we need a well-balanced and well-designed donor health questionnaire. It's a mathematical model. It has shown if randomly donors are taken, the incidence of HIV is 4 times or 4-fold increases on nucleic acid testing. This model is designed on, it is published in 2016 on the Vox Sanguinis. And another important thing is blood donor questionnaire or donor health questionnaire and the donor selection criteria are complementary to each other. And in some cases, they may to some extent, this donor health questionnaire also help in prevention of bloodborne infections or transmissible infections from emerging and re-emerging pathogens. But the actual problem here is art of designing a good donor questionnaire. And we all know the blood and blood components is a licensed drug in majority of the countries. So to assure blood safety, there should be the minimal risk of bloodborne infections or TTIs. And also it's a combination of technical improvement, that is almost zero risk transfusion is possible due to nucleic acid testing. Also, there should be non-technical pre-screening methods, that is education of the blood donors, non-remuneration concept of voluntary blood donation, and donor health questionnaire, which I have told that donor selection criteria as well as the donor health questionnaire, they are side by side complementary to each other, and depending on the answers or responses of the blood donors on these health questionnaires, their health status, risk behaviors, and possible and probable exposure to bloodborne infections or sexually transmitted infections, they can be assessed. So donor health questionnaire formulation is always a challenge, because it is scientifically designed, but it has to be ethically and legally justified. So science, ethics, and legal justifications. So it should be a mixture and convergence of all of the ideas. So that is the challenge. But the effective donor health questionnaire is the cornerstone of the blood safety. They minimize the donor adverse events, as well as it acts as a safety barrier to reduce bloodborne infections or TTIs. There is a very interesting study to evaluate the quality of blood donor selection. They may be evaluated by monitoring the response and the way of interviewing in the donor health questionnaire, and also versus the analysis of donor deferral rate. So it is published in Frontiers of Medicine on 2018. So we all know blood donor selection process includes 4 main steps. The 4 main steps, they include their pre-donation information, especially related to transmitted infections or bloodborne infections, high-risk behaviors, as well as the blood donor adverse events. The next important step is, once the pre-donation information is given, the donor health questionnaire is filled by the blood donor in assistance with the health professionals. Then it is followed by the blood donor interview by the health professional. And last, that is the donor health assessment by the medical professionals in our country. It may be trained professionals in some other countries across the world. So this is the, if we look at the, in a nutshell, the donor selection process, you see there are all steps, that is pre-donation information, completion of donor questionnaire filling, donor interview, donor health and risk assessment. There's a provision of for self-deferral. So once the donors are accepted, medically fit, again the blood, maybe during blood donations, donor can give the option for confidential unit exclusion, or after donation, if the donor comes reactive or some abnormal results, the donor may be considered for post-donation counseling. And also there are cases where we can assess the temporary and permanent deferral criteria. And if the donor is temporarily deferred, they can be motivated and included in the blood donor pool by their counseling and advice of some medications. So evidence-based donors selection of blood donor, they involve, that is the most important, there should be appropriate changes in the current donor health questionnaire and the guidelines, and that should be evaluated. There should be clarity in the donor selection to optimize the blood donor deferral. As I have told, selection versus deferral, the criteria should be such, there should be balance to enhance the blood safety. It should not involve any ultra defensive approach. It is very important, because sometimes we may, to assure blood safety, we may become some ultra defensive. As for example, it may be related to the health questionnaire, related to blood pressure of the donors. It may be related to asthma in the donors. It may be related to the thyroid conditions in the donors. So there should not be any, or any other conditions. I am giving some examples. Then maybe many conditions where we can be ultra defensive approach in preparation of the guidelines, and that will definitely lead to a higher rate of deferral. Address to the possible impact of future blood availability. So it is also important, if the number of donors are highly higher, the deferral rate is, the future blood availability may be questionable. And it should be uniform across the country or a large population in a certain region. This, if a good donor history questionnaire, donor health questionnaire is formulated, and if it's made uniform across the country, it will benefit lots of people, it will be economical, and it will be the most practical approach to assure blood safety, especially in the resource-constrained regions. So selecting the right donor and right questionnaire, what are the challenges they come? The questions should be very short and appropriate. They should avoid technical terms and jargons, because ultimately the donor has to comprehend the questions and give the proper response. There should be avoidance of double-barreled questions. Double-barrel means a single answer to many of the issues. The question should not be set like that. The issues should be defined specifically, and any measurement or assessment should be done donors on the basis of the ordinal scales, that is quantitative measurement of the donors, where the donor can give quantitative examination. Because if I say, suppose for example, do you have any history of fever in the last month? So sometimes the donor might say, well, there may be fever, there may not be fever. Then if we ask of the severity of the scale of fever, then we can get some response here, it was severe. But if I properly ask whether what is the temperature recorded during that time, that should be in the ordinal scale. Otherwise, the questions comes in the nominal scales. They should not be. They should be avoided. So, and also avoidance of complex sentences in formulating the donor health questionnaire. And on the other hand, the donor's perspective, they should properly interpret the donor health questionnaire. They should not, their memory should not be taxed. Suppose if a donor has donated blood 4 years ago, if I ask at which date you have donated the blood, it will be very difficult to retrieve from the memory by the donor. So questionnaire should be designed in such a way that should not be taxing in the memory of the donor also. There should be balance of judgment and non-judgment, because it is a very subtle way. Because if I say, if suppose for example, if I speak to the donor, if we see the persons having multiple partners are having high risk behavior, so here there may be chances, especially in sexual risk behavior, donor may give some his judgmental opinion, although he or she might have number of partners, but at that time they may be judgmental, they may hide this response, proper response. So that is very important here. So it should be a balance of judgment and sometimes non-judgmental issues should come in the response. And also response editing. So the donors, it is very important, especially where computerized donor response is recorded. So here the donor have the option to edit the response. Now, another part, because why evidence-based donor selection is included, because that is the blood current quality assurance in blood transfusion service. It is approaches from vein to vein, that is from the donor to the transfusion the recipient. And identification of the right donor is always a very critical input in this quality assurance of transfusion services. And another most important part of this is intention to donate blood is the key motivation to practice blood donation. So the questionnaires, guidelines, whatever we decide, first of all, we have to assess in the population the intention to donate. It depends on demographic distribution. It depends on the knowledge status or education of the blood donor pool. It depends on the cultural behavior and socioeconomic practice. So it is worthwhile to study the intention of a group of population for blood donation and come up with evidence-based interventions. It is important because until and we assess the population's motive, we cannot design the guideline. Until and unless we design the proper guidelines, we cannot get the adequate number of safe donors. There is a very important analysis in this paper, that is reasons for blood donation among the donors. You see, individual initiative which plays a great role. Then comes organization initiative, that is initiative from the organization, that may be their societies, their local organization, or they may be the organized blood transfusion services. So it is very important. There should be individual initiative on the donor's part to donate blood. Then everything, the donor selection criteria, donor health questionnaires, quality assurance comes. And on parallelly, if we see the reasons for not donating blood among the donors, that is lack of knowledge, fear and anxiety, lack of interest, and lack of opportunity. So they form a major cause where the donor doesn't donate blood. So the criteria should be evidence-based, questionnaires should be rightly designed so that we can educate the donor properly, we can counsel the donor and helps in the participation to make the voluntary blood donation successful. Another part which is now recently becoming a very important concept in the research, that is association between donor characteristics, blood quality, and patient outcome. There are quite a number of studies which show that in vitro quality of stored red blood cell products or platelet concentrates may be affected by some of the donor characteristics. So a proper selection blood donor based on evidence-based criteria, it is needed to minimize donor-associated risk for poor product quality. So this is again, if I consider the process input, you see donor selection criteria or the blood donors who get selected, so they form a major important part in the to maintain the quality of blood and blood components. Other variables are there like time limit for blood processing, environmental control, component specification, storage temperature, but the most important is the blood donor and its blood donor selection criteria. There is a right donor. So going through the research, another important thing came, that is due to hemovigilance, that we get to know the right gender for plasma donation, because the gender of the donor may influence the type of blood component prepared from the donation. That is, plasma-rich components from multiparous women are more likely to cross trally and related disorders than those from the males. So because the plasma from these donors, they contain antibodies which against human leukocyte antigens or human neutrophilic antigens, which are transferred passively during the transfusion. Another important thing is related to hemolysis, or related to the hemolysis, there is an inherent enzymopathies in the donors or red cell membrane defects. So it has been observed individuals with G6PD or other inherited red cell membrane defects without history of hemolysis, a history may be acceptable, but how their blood is not suitable for intrauterine transfusion, neonatal exchange transfusion, or patients with G6PD deficiency. There is again another important study showing proteomic analysis of red blood cells from the donors. They exhibit a high hemolysis and demonstrates a reduction in membrane-associated proteins involved in the oxidative response. So we know, all of us, we know already that red cell storage lesion is a multifaceted biological phenomenon. So genetic, undiagnosed, or subclinical medical conditions and lifestyle factors, they may affect the RBC characteristics, their lifespan, energy metabolism, and sensitivity to oxidative stress. So nowadays, the donor-related studies are much more looking at the proteomic analysis of the red blood cell membranes. This is a this is the picture which showing the RBC membrane disorders, hereditary. We all know we do not screen routinely among the donors. We only screen the hemoglobin level, but they play an important role in the quality, in the stored in quality of the blood component, and some of the patient outcome. So an increased understanding of these variables can be used to improve the quality of blood components for transfusion. And also we may use some donor management algorithms based on donors' individual and molecular and genetic profile in the future. So assuring high quality of blood components, it is always challenging because variable nature of biological raw materials, which a blood is collected from a donor, there may be different due to technological improvement. There is different manufacturing processes. They are coming different methods of platelet preparation, platelet storage, platelet preservation, red cell preservations. They are coming. There may be pathogen reduction technology. It will be in the near future, in futuristic approach. So they are coming. So different manufacturing process. So the donor characteristics becomes very important. Variation in quality testing methods, and some of the products even are subjected to some non-traditional manufacturing or storage. As I have told that they may be pathogen inactivated, they may be irradiated. So they are non-traditional manufacturing processes. So that they have to the RBCs or the particular component has to sustain those variations. So current good manufacturing practice ensures the blood operators to maintain safety, quality, identity, potential, purity of the blood components. So this is a picture which showing the understanding the relationship between blood donor variability and blood component quality. So here you can see the donor factors, that is, we do not routinely screen in the donors, but they may be important in the coming days. That is genetic abnormalities, enzyme deficiencies, red cell membrane defects, platelet receptors related, platelet responsives. Regarding the donors, lifestyle like smoking, alcohol, BMI, lipemia, medications, and interdonation interval, which may play a very important role in the coming days. Production factors like different processes of filtration, leukofiltration, platelet productions, anticoagulant plasticizers, post-production that which have already and storage, they also play a role. So ultimately, the evidence-based guidelines and rationally designed donor questionnaires, donor health questionnaire also becomes important in this issue. And last but not the least, the advent of very precision medicine, which seeks tailored to the healthcare delivery. So we all know now that is medicine is evidence-based medicine, and to achieve maximum benefit based on an understanding of the factors that contribute to health and disease of an individual and population. So medicine is now becoming individualized. And also maybe at point of time, the donor quality, donor characteristics are also become very important to in the patient's treatment and its outcomes. There are interesting studies, I think also in the CME also, we have some separate topic which is taken by quality donor characteristics influencing the quality of the blood components. So the interplay between the donor characteristics, blood product preparation, storage, and patient characteristics on the outcome of a transfusion is always multifactorial. And there is a very interesting study published in Blood Journal on September 2019. So this study, the effect of donor component and recipient characteristics on hemoglobin increments following red blood cell transfusion is noticed. Here we see very interesting observation. It is done on 23,100. It is a retrospective audit, of course. It is done on 23,194 transfusion recipients who received one or more single unit RBC transfusions from the period, their 8 to 9 years period, 2008 to 2016 in Northern California. Here we have seen, they have shown that blood donor influences the response. That is, male blood donors having age less than 70 years, Rh positive donors blood, they have shown to increase the hemoglobin rise in the transfusion recipient. Again, the method of preparation, that is apheresis blood collection, gamma irradiation, and storage of blood more than 35 days, the transfusion of post-transfusion hemoglobin increment is less. And on the recipient factor, again, female recipients, Rh positive recipients with lower body mass index, low hemoglobin level, the percentage, the hemoglobin increment is increased. So these are the factors. So the future points towards that there should be individualized donors. There should be evidence-based donor selection criteria which addresses to the donor requirement according to the customized need of the patient. So understanding evidence-based selection of blood donor, it involves appropriate donor selection guidelines followed by the right donor health questionnaire, and it should rationalize the donor impact deferral and the impact of donor deferral. That is very important. We cannot lose the donor availability by creating very stringent criteria. So we have to focus on that. They should rationalize the deferral and the impact of donor deferral. They should address to blood donors and recipient safety. They are an essential part of quality assurance in blood transfusion service. And last, to conclude, I should say, increased understanding the variables can be used to improve the quality of blood components for transfusion by using donor management algorithms based on donors' individual molecular and genetic profile. So they are the futuristic approach, or rather the approach is ongoing now. and very ongoing. And these are very important things, that evidence-based selection of blood donor is a very important part in the blood transfusion service, and which will which will be of a major area of interest in the coming days. With this, I thank you again, and thank you all, for all the viewers. Thank you.